we serve a very large catchment area of Lehigh Valley, as well as all these northern facilities that all refer cases in. We have a big infrastructure to be able to support that volume. And then we have an amazing team. And that team is not just the clinicians, it's the APCs that help take care of those patients when we're recovering our patients. It's the nurses in our OR, the nurses in our cath labs, and probably even more importantly, in many ways, the nurses on our floors. You have to have a physician culture that believes healthcare quality matters. And so we have a team that's been built up over the years that helps us gather the data, it collates the data. All of that then gets taken up to the physician champions who then disseminate it to their respective teams, whether it's vascular surgery, cardiac surgery, or cardiology. Those teams then meet regularly on an individual basis, so the cardiac surgical has their time, vascular surgery has their time, and then semi-annually, we have a team meeting where all of our quality programs across the whole Heart and Vascular Institute sit down and we all present our data. Here's what we did really well this year. Here's what our data quality shows us as a signal we have to pay attention to.
We've been growing, especially the last couple of years, growing at approximately 10 to 12% a year, which is spectacular. Results have been outstanding. The hospital system has a very large presence in its region.
Our program is fairly high volume. Our index cardiac surgery cases is over 700, and then we also do about 300 plus transcatheter aortic valve operations, mitral clips, M-tier programs, about 60 or 70 ECMO cases a year. And we also do quite a number of aortic surgery operations.
We have the gamut of heart failure cardiologists, cardiac surgeons that are skilled in all facets of heart surgery. And we have a multidisciplinary approach to tackle these problems for each individual patient.
In all the major specialized area of cardiovascular surgery, we have world experts, people that are routinely speaking on the national and international stage, routinely doing research in these areas, and routinely publishing in these areas. So we really are pioneers in many of these very complex pathologies. And we will use that deep understanding that we have gained through our research to make sure that we provide our patients with the best long-term outcomes.
So we have embarked on a program to provide minimally invasive solutions for some conditions. Not every condition can be treated with minimally invasive solutions. However, we can replace heart valves through the arteries of the leg. That's standard of care. We also have the ability to do more complex surgeries such as aortic aneurysms, thoracoabdominal aneurysms with a minimally invasive approach.
We pride ourselves in being able to take care of anything in the cardiovascular realm, anything aortic dissection, aneurysm, heart disease, vascular disease, anything. And that really is kind of our philosophy and our vision, and we work really hard to try to accomplish that.
Yeah, so I think sometimes patients get turned down from other institutions for several reasons. One is there's not enough surgical expertise. Sometimes there's not enough staffing. Sometimes there's not enough experience. And so we feel that we have all of those work in our favor. We're able to provide excellent surgical techniques. We have a lot of experience amongst all of our colleagues, surgical colleagues. And we have been doing this for a very long time. So we can offer these patients some of these more complex operations where others can't.
But very, very importantly is the cardiac surgical ICU and the expertise in the ICU, which allows us to do all of these very complex procedures, including redos and very sick patients. You have to have high volume. If you have high volume, then you can absorb some of these issues. But if you're really a small place, you simply can't do high-risk surgery because you don't have a big enough denominator to do that and have good outcomes and have high-quality metrics.
Lehigh Valley has recently joined Jefferson Health, and I think that that's been enormously impactful for my practice and the practice of cardiac surgery and vascular surgery at Lehigh Valley and for our patients.
Unlike maybe business mergers in a way, I think a lot of these healthcare mergers that you're starting to see are about extending an opportunity to improve the care, to improve access to different levels of expertise that you previously may not have been available to a community.
The kind of larger collaborative Vascular Surgery and Cardiac Surgery Cardiovascular Disease Consortium is much larger and better informed now. So I now have partners down in Philadelphia, and they have partners up here.
We work closely with the Jefferson cardiothoracic surgery team. There is some overlap. We do have a few of our surgeons working both here and down at the Jefferson site. We work closely with heart failure doctors and interventional cardiologists to help us perform some of these minimally invasive valve procedures. So it is pretty much like a team effort. So we have a lot of people weighing in.
The level of expertise and intellectual curiosity and sophistication is definitely going to increase at Lehigh Valley and at Jefferson as a result of the two organizations joining together. So more smarter people means more smart ideas and more intelligent and sophisticated care of patients.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.